As I said, genetics is a very fascinating field. I always say that we have, like Paul Shattuck always stated, you have it now? Va bene? Ok. Molto bene. Mi dispiace per questo. As I said, Paul Shattuck always showed me and always taught me that we cannot think of autism as a genetic problem, but we can think of it as a genetic fragility and not as a cause of autism. Okay, so we are talking about the epidemiological data show that in recent years there has been a significant increase in the prevalence of autism spectrum disorders. It has gone from 1 to 5,000 in the 1980s to 1 to 59 cases now, actually, in Italy, and I think also throughout Europe. We always say that it's a multiple etiology where environmental factors, infections, genetic factors, protein from diet and peptides, neurological factors and conditions, and also chemical toxic factors, which are released to significant relationship in the early period of life. So it's very important the first 1,000 days of a child, from the moment the woman comes pregnant up to the moment that the child is born. In literature, the prevalence of gastrointestinal symptoms is reported between 15 and 91% in subjects with ASD with an age of 1 to 18 years. This variability is due to different approach methodology, different threshold of pain, patients who do not communicate verbally. Maybe 50% of them don't communicate verbally. The concept of possible secondary issues, nature of autism, behavior emerges. Examination of biopsies of the distal portion of the ileum of children with ASD reveals the proliferation of cell crypts, thickening of the basolateral membrane of the intestinal epithelium, and an increase in intestinal permeability, the so-called leaky gut syndrome. Study found an altered intestinal permeability in almost 40% of autistic patients. Increased permeability can help increase reactions to food components in the intestinal tract of children with the ASD. Autistic individuals have unique intestinal bacterial populations responsible for the variety and severity of symptoms. So we know that there is a direct interaction between intestinal microbiota and enteric neurons, the HPA axis adjustment and production of important chemicals in brain functioning, as such as serotonin, dopamine, phenylalanine, gamma-aminobutyric acid, essential fatty acids, and p-cresol. This biotic microbial community may cause systemic inflammation to the hyperactivation of the Th1 and Th17 response, which also affects the reactivity of peripheral immune cells to the cellular nervous system and the integrity of the blood-brain barrier altered in ASD patients. This biosis and intestinal permeability can activate the immune system and influence condition the brain in situations such as autism and mood disorders, also ADHD patients. The intestinal permeability is consequent to the diffusion in the blood of opioid peptides, gluten and casein derived from the diet, and to the production of a powerful pro-inflammatory endotoxins, such as lipopolysaccharide, LPS, derived from the cell wall of gram-negative germs. LPS has an important influence on the modulation of the central nervous system, increasing the activity of areas responsible for controlling emotion like the amygdala. So the alteration of native intestinal bacterial flora leads to colonization by bacteria capable of producing neurotoxins, contributing at least in part to autistic symptoms. A study showed that serum LPS levels were significantly higher in autistic patients than in healthy individuals and correlated with socialization scores in an inverse and independent manner. the scientific evidence demonstrates the role of the microbiota in the alteration of the intestinal barrier in the genesis of ASD. In one study on over 15,000 autistic children aged between 20 and 60 months, the intestinal symptoms were 8 times higher than in the control groups. One of the bacteria associated with autism is Sotorella. The urine and blood of autistic children show a high concentration of metabolites of this bacterium. On the other hand, autistic subjects have a strong deficiency of useful bacteria, the friendly bacteria, such as Prevotella. Through the examination of the stools, it was found that in the intestine of autistic subjects, there is an excess of certain clostrids. Clostridia, as I should say, form neurotoxins and are able to survive even after treatment with sulfamethoxazole and trimethoprim antibiotics. The presence of Clostridium is about 46 times higher in microbiota than autistic children compared to controls. A metabolite bearing the name of 3,3-hydroxyphenyl 3-hydroxypropionic acid is the signature of the Clostridium spp and can induce symptoms of autism, causing catecholamine depletion in the brain. The concentration of this metabolite is higher in autistic children, up to 300 times higher. Several studies have shown the importance of this metabolite and other of the bacterial derivation in autism. Here you can see the pathway where diet, prebiotics, probiotics, antibiotics, postbiotics, fecal transplantation, activated charcoal will all influence the gut microbiome brain axis from the gut to the brain, and so also the behavior. Fecal microbiota transplantation, FMT, consists of the injection of filtered feces from a healthy donor to a patient for the healing of a specific disease. Although it was useful sporadically in ancient times, its first application in contemporary medicine dates back in 1958, so it's not very new, when the Englishman Ben Eisman infused fecal material in 4 patients with pseudomembranous colitis. After this pioneering experience, several attempts have been reported over time for the treatment of Clostridium difficile infection. To date, several systematic reviews and meta-analysis, as well as 3 randomized controlled trials, show the undoubted efficacy of FMT for the treatment of recurrent Clostridium difficile infection. At present, I should say, despite the theoretical background, the application of fecal transplant to autism has been tested only in a few autistic children, in which it showed an improvement in specific symptoms. But we need more data on that. Numerous evidence shows that gastrointestinal symptoms such as abdominal pain, intestinal gas, diarrhea, constipation, and flatulence are a common comorbidity in patients with autism. Since the intestinal microbiota contributes critically to the metabolism and maintenance of immunological homeostasis and can control the central nervous system through neural, endocrine, and immune activities, the active role of the intestinal microbiota has been hypothesized in the pathophysiology of autism. As you can see here, abdominal pain, constipation and diarrhea, reflux, food intolerance. This is what we usually say, but we cannot say that this is the only cause. As Hans Asperger correlated food influence, nutrition and gastrointestinal status on behavioral disorders. So we must always say the familiarity of autoimmune diseases, disorders during breastfeeding or weaning, frequent infections, dermatitis, gastroenteritis, acute infections event, constipation, pain and diarrhea, and behavioral disorders. This must be the medical history always written down and asked the parents. We often see children like this that we have filmed and we have photographed. The position they get when they have abdominal pain, they have constipation or diarrhea, they don't know how to act. So they find a way to be comfortable with the symptoms that they are present. Here, the big belly of the child, the way they go to the bathroom, and the way they stay on the floor. So we have many symptoms associated with gastrointestinal discomfort. So the environment influences the immune response, how they connect. Of course, antibiotics, diet, hygiene, lifestyle. We eat something, we develop food intolerance, we get chronic inflammation. This will lead to metabolic dysfunction, will alter the intestinal microbiota. So we have immunodeficiency of NOT2 and interleukin 10. And we have an hyperimmunity response, such as interleukin 6, 12, and TNF. So it's important to look at the gut leakiness and the inflammation related to SD. So we must always restore the integrity of the intestinal membrane. Otherwise, we will have any type of macromolecules will interfere with the brain and activate inflammatory cells. And of course, we know about gliadomorphins and casomorphins, which will act as inflammatory stimulation. So we know that once we act, we go and create an imbalance in our absorption, gut absorption. We're going to affect the psychological disorders, abnormal behavior, cognition deficit, anxiety, autism, and visceral pain. So obviously we have neuroendocrine, neuroimmune, autonomic nervous system, integrated nervous system, all involved in this situation. And so we're going to have any type of disease once the microbiota is altered. And so we must always restore the dysbiosis that has been created. There are many publications, of course, in this matter. So food has a direct effect on the composition of the intestinal microbiota. The intestinal microbiota responds quickly to dietary changes. In a couple of days of avoidance, in a avoidance diet, you will see immediate results. A diet rich in sweet foods and refined carbohydrates increases the population of various yeasts, especially Candida albicans in particular, of Staphylococcus and Streptococcus, and some species of Clostridia and Bacteroides, also favoring the proliferation of worms and other parasites in the intestine. So the priority in the treatment is first to identify and eliminate sources of toxins, correct the nutritional imbalance, eliminate food and chemical allergens, optimize neurotransmitters levels, and start immediately detoxification. The use of healthier long-term dietary patterns, example, increase the consumption of fruits, vegetables, and whole grains, and lower intake of processed foods, simple carbohydrates, and fried foods, have been associated with microbial profile that could potentially protect from diseases. So it's a prevention that we're doing. So in how we conduct our visit and our follow-up of children with hyperactivity, avoid gluten and dairy products, limit sugar intake, avoid additives, preservatives, and dyes, allergy testing, calcium, magnesium, and essential fatty acid supplementation, administer taurine if it's low, and possible antifungal treatments. Very often we have fungi affecting the child, so we must block down possible invasion of fungal mycosis. Improve attention again, gluten, dairy products, allergy tests, essential fatty acids, and try also with the methyl B12, DMG, coenzyme Q10, and ginkgo biloba integration. For speech delay, again, nutritional interventions, treat gastrointestinal dysfunctions, administer methyl B12 and gamma-aminobutyric acid if the level is low. In aggressive behavior, exclude the various pathologies. Firstly, nutritional interventions, avoid common triggering headaches, taurine if slow level, correct the mineral deficiencies, gamma-aminobutyric acid if the level is low, and calcium up to 1 gram per day. When we have gastrointestinal symptoms, we must avoid gluten and dairy products, reduce the carbohydrate intake, digestive enzymes if they are needed, probiotics, test for food intolerance. We utilize cytotoxic tests for this matter, essential fatty acids supplementation, antifungal if necessary. For constipation treatment, again, nutritional variations are important. Increase fluid and fiber intake. Many often children don't drink. You need fluids. Buffered vitamin C, magnesium and English salt baths if are needed, digestive enzyme, and take care of the hygiene. Very often children put their hands in the back and then they put in the mouth, then transmit bacteria from the anus to the mouth. In sleep disorders, again, the diet is even important. Avoid glutamine and glutamates, drastically reduce sugar intake, test for food and chemical intolerance, and test for the presence of fungi in the feces. Also, you can give supplementation of melatonin before bedtime, magnesium and taurine, gamma-aminobutyric acid if the level is low, and also calcium. As I said, all truths have 3 stages. First, they are ridiculed. Second, they are violently challenged. And thirdly, they are accepted by giving them as evidence-based and claim them as proper. It's not Carmelo Rizzo. This was Schopenhauer. So I want to thank you again for this. And if you have any questions, just write and I will be able to answer you. In any case, you have my email. If you have any questions, of course, you can write me at any time. I will answer you. I hope to see you very soon in another webinar. Thank you very much.
Sorry, I was muted. Okay, thank you so much for your presentation. It was very informative. We have some questions that came in, but I think you pretty much answered it in your presentation. So maybe the best thing is if we receive the emails from all the all the people that are interested in specific questions, okay, and then we'll send it to you. But I can see that all the questions that I have here have been already answered in your presentation, especially towards the end. So thank you so much again, and see you sometime soon, maybe in person.
Thank you. Thank you very much. Okay, I abandon you for another conference. Thank you very much.
Thank you.
Bye-bye.
Thank you. Bye.
Bye.